Coronary anastomosis. The coronary anastomosis is probably one of the most challenging exercises that we do in this trainer, mainly because it's a long suture, it's a very small suture, it can get tangled, and it can be hard to keep everything symmetrical. Use the small coronary supplied in the box, and you have it hanging by one of the holders, and that sort of simulates an assistant holding it for you. This will be the heel, which will correspond to the heel of this target here, and this will be the toe, which will correspond to the toe of the target there. So this is, if you notice, it's about 8 millimeters oblong, and it kind of mimics the location of LAD anastomosis, which is on the anterior aspect of the heart. The other holes tend to mimic things like the OM1 or OM2 or lateral circumflex on the side wall. But for today, we're going to focus on the LAD, which is nice and anterior. Goals for this exercise are symmetry, needle handling, needle angles, delicacy of technique, and being delicate with the needle on the tissue. Okay, so we'll get started. To make this easier, and there's a lot of different ways to do this, but we're going to start one off the heel. So if this is the heel, we're going to be one off, which is right here. Full thickness on the vein graft. And this in and of itself can be tricky. You want to hand it off to your pickup, but you need to use some other implement to move things out of the way. Now I'd like to set myself up for the next stitch. That was a backhand. Next stitch is going to be a backhand. So I can do that up here with the support of the vein even. Or you can do it down on the surface of the heart. So here I've got the backhand, but it's got a little bit of a forward tilt. So I've kind of corrected that. So it's about a 45-degree angle, the backhand. So I'm going to deliver some suture towards me, up towards my shoulder, without touching my shoulder. And I'm coming back down into the field. You can see there's big loops of suture and stuff. You don't want to tangle yourself. Normally you'd have an assistant following your suture. This would be dead center at 12 o'clock, so I'm going one off the heel, which is at about 1 o'clock. On a coronary, you want to go right underneath the lip of the aortotomy that you made. They don't tend to be very thick bites. They tend to be very, very small. For the purposes of today, we're just going right underneath this lip. Any lip that you designate there, you just want to be consistent. Now I have a loop here that I don't want to get caught in. And I tend to reload on tissue if possible, especially for smaller needles. Smaller needles are hard to reload in your hand. So smaller needles are nice to reload on surfaces. I'm going to pull this up like so. I'm going to come back over here, and now I'm going right dead center into the heel. Now I traveled about 2 millimeters or 3 millimeters from the edge there, so I'm moving 3 millimeters away from my last stitch. Handing it off to myself. And again, I know my next one is, for me, it's going to be a forehand with a forward tilt. So I'm going to go ahead and load it. I don't like to load in the air. I like to load on with something supporting it. So it's got about a 45-degree angle forehand. Now I'm pulling this through and now it's nice and taut. I'm going on this side, not on this side. I'm going counterclockwise. Needle's going underneath the lip, and my left hand is pushing down. There's some subtleties to when you do a real coronary. This is a very important stitch. You don't want to catch the back wall. In this trainer, we really don't have a back wall for you to catch, but you have to be cognizant of that. So now I'm reloading. Typically, all your shots through the vein graft are going to be backhand. So I'm pulling this up. Now I got to go again 3 millimeters away from this last stitch. Try to avoid grabbing the tip of the needle, or if you do, very, very gently. Now this one's going to be a forehand. It's too much of a forward angle, so fix that. So this is a forehand with a 45-degree angle. Pulling up just to keep all the sutures nice and taut. This back one I can pull on just a little bit. Usually don't want to use your instruments on purling because you can tear them. So now everything is nice and taut. And the rest of these are going to be forehand, so I'm just adjusting it right here on the surface. So now I got to deliver the graft down. So you can sort of gently lay it there. A lot of this stuff is just being very gentle and trying to be as real as possible. So if you tear something, that's like a critical fail on this. Every time you do it, try to take it as seriously as you can. So I'm trying to get rid of the redundant loop, but I also want to leave myself enough suture with my right hand. I don't want to run out of suture. So I'm just seating this like so, and I think this is good. And you want it to be nice and snug on the back wall. You don't want to have big loops there, or else you'll get bleeding. Now for me, these are forehand. So I'm grabbing the toe, pulling this over, and I always look to see where my last stitch was, which was right there. So I want to travel about the same distance. Like so. And now I'm going to notice this. I'm going to hand it off to the pickup, and I let go immediately. You don't ever want to handle it with the pickup and your castro at the same time, because it can tear the vessel. It's going to be a forehand. I want to advance about the same amount, about 3 millimeters. And I want to reload it forehand. Trying to pull it nice and snug, but I don't want to break it either. Left hand is grabbing the toe, pushing it out, and I notice that the toe is there, and here's where it's going to end up. So I have to go from here is probably 1, 2, 3, 4 stitches. So it's 1, 2, 3, 4 stitches there. So you want to kind of be pretty symmetrical. These are all forehands with slight 45-degree angles. This can get caught on the side just like it's doing now. You want to try to correct that. Don't allow a knot to form. This is right at about the center. And I think this one I can take in one. Still a forehand. It's a better bite on this one. Now, sometimes if you turn your back counterclockwise, you can keep your same forehand in a little bit of a reverse manner, or you can just switch to backhand. So we're right at about where we want to be for our shoulder, head, and shoulder stitch. Now this stitch tends to be a hook shot, so it's a forehand, and then rotate the needle towards you. I leave it loose here. Get underneath the lip. You really want to pretend that you're not getting the back wall. Here we'll just turn it into a normal backhand. So we should be right at the toe. These tend to be a little smaller bites and a little bit smaller travels when you're at the toe. Now this can either be a forehand hook or a backhand hook. We're going to make this one a backhand. Coming underneath the lip. And really supporting with my left hand. The tissue so that you can grab your needle. Now we got another backhand. This backhand doesn't have to be as much of a hook because you actually want the needle to point out this way. So you want it to be symmetrical to this. Your left hand is pretty important here. So now let's look at our back wall. This looks okay. Okay. So now I'm going to just plant this needle here on the side, and I'm going to grab my other needle and come around. So we've got about maybe 4 stitches or so from there, and same thing around here, about 4 stitches from here. So I traveled about 2 millimeters there, so I'm going to move probably about 3 millimeters away on this one. So I want to start making a little bit of progress. Again, when you grab it with your pickups, you got to let go immediately with your Castro. You can never have pickup holding the needle and Castro locked. That will result in a tear of the artery. It's very hard to do this without somebody following you. So you tend to appreciate the importance of a follow. You can have somebody follow you if you'd like. But it helps you a lot to practice without it as well. So I'm just loading. These are just forehand. Again, there are many different ways to do this. It's just for this exercise to show needle handling and symmetry, that's all. So there's the needle. I'm kind of letting it sit there so I can go back in with the soft tips of the Castro and pull it out. Hand it off to the pickups. And I'm sort of just gently using the vein to push it into the type of forehand that I want. Double checking my forehand, there's no pitch, there's really not much of an angle here, which is fine. We've got maybe about 2 more bites here, or even 1. Have loops on when you do this for sure, so that it's as real as it gets for you. And that's it. So we look along the back, look along the front, and we can tie it down. It's going to be a one-handed knot. Do the first two in the same exact direction, sliding down the pole. I keep my finger on the knot and I pull up on my left hand a little bit just to set the knot down. And then I really try to avoid pulling up on that knot anymore. Then we change directions. Then we get about, really want 8 throws in proline typically. We're not going to be reviewing the knot time right now because it would take the whole video. This is mainly just to review needle angles and sewing the grafts. Now, just take a quick look around. There's the one that was one off. This was the 12 o'clock. This is the 11 o'clock stitch. So this is what I refer to as the right shoulder, head, left shoulder. That's symmetrical to this over here, which is left shoulder, head, right shoulder. So this is about 6 o'clock. This is about 5 o'clock. This is about 7 o'clock. Got a couple of sutures along the right side and roughly equal amount along the other side. Each one seems roughly evenly spaced compared to the other, with the exception of this one. This one was a little closer to the edge than the other ones had been. And on this side I think they were alright. So you always, at the end of your anastomosis, you want to evaluate what you did and make corrections on your next one.